Hi, I want to welcome everyone to part one of our two-part series on navigating healthcare trends today. My name is Robin, and I will be your Microsoft host for this webinar. Healthcare is an ever-evolving field, and staying ahead of the curve is imperative for success. As referral leakage continues to grow year over year, this challenge is top of mind. Large healthcare systems are seeing overall leakage in the tens of millions of dollars annually. So I am thrilled to have Sarah Howe, Vice President of Product at Imperial Dynamics, here with me today to talk with us about this challenge. So let's take an opportunity over the next little bit of time to dive in, and feel free to put your comments and questions into the chat window. Sarah,
Awesome.
if you want
Hello.
to take us to the next slide. There, yeah. Imperium Dynamics is a Microsoft partner who is known for helping customers resolve business challenges. It's exciting to have a partner that is making commitments in the healthcare space, and they're taking the time to develop crucial IP. Imperium Dynamics recently announced they have developed integrations with all three of the major EMRs, including Epic. They also have developed ISV solutions specific to healthcare as they embrace the challenges with their existing healthcare customers. Today's webinar is just the beginning as we aim to turn this into an ongoing conversation for learning, engagement, and collaboration. So be sure to scan the QR code you see here and join us next Tuesday, November the 19th, for a roundtable discussion so we can get into smaller groups and have more meaningful dialogue. As you can see from our agenda, we have some big topics that we're going to touch on today. To ground the conversation, we have chosen to use a patient example around lung cancer in honor of November being Lung Cancer Awareness Month. I am thrilled to turn this conversation over to Sarah to walk us through referral leakage and a patient journey. Sarah?
Hi, everyone. It's great to meet you, and thanks for joining us today. Um, I'm really looking forward to talking about referral leakage. I think it's a challenge that almost every provider is facing in the U.S. and something that has a big business impact. So I've been implementing Dynamics for a long time. Excited to share some of my learnings from that with you all today. But first, I wanted to kind of just drill down a little bit more into kind of the challenge itself, right? So, we know leakage itself comes from many different angles within a provider, but especially even with referrals specifically, I think there's some stats that only 35% of referrals actually result in a follow-up appointment being booked. So there's a lot of patients who are being suggested to come back in, whether it's for follow-up appointments or for follow-up testing, and they're either not coming back, or they're going and getting that care from another system. So there are a lot of different reasons for that. In some cases, I think it's accessibility, right? Patients just not having the right information, or knowing who to call, where to go to actually book that appointment. In other cases, it has to do with bigger challenges that the healthcare system faces, such as interoperability, having the data within your network, having the data when patients go outside the network, and being able to actually keep the reminders going, and kind of follow up with them and keep them in the network, and also adhering to their care plans. So those are some of the major kind of causes that we see around referral leakage. But all in all, those kind of cracks in the system are leading to very, very large impacts when it comes to revenue. So we see some stats here, right? Approximately 5 patients are lost weekly to leakage, which results in about $3,000 per patient, and that becomes $15,000 per week per employed physician, and that all aggregates in a year to $780,000 of revenue that could have been realized per physician. So it's really adding up to very great numbers, as Robin mentioned herself in the beginning there. So let's talk a little bit more into how we could really address this. So we have kind of a story that we want to talk to today around, lung cancer awareness month. So as we know, right, lung cancer is kind of known as the silent killer. It's one of those cancers that's often diagnosed way too late, and it results in worse outcomes for the patient's overall health. So it's one that we really want to take seriously if we're able to identify it early and act on it early. Prevention is going to give us better success when it comes to the specific type of cancer. So in our scenario here, right, this is there's a health system, we're called Imperium Health System for the story purposes, and they have an emergency department that's running on Epic within their hospitals, but then they have a larger chain of specialty clinics, providers, and so forth. They're kind of an integrated delivery network, right? Those specialty clinics are running on Athena. So they're all one system, but they do have multiple EMRs going on depending on the type of practice or location. So Joe here, visits the ER because he broke a rib, and while he's doing that, some of his scans pick up on an incidental lung nodule, indicating that he could have early stage lung cancer. So he's recommended to follow up with his PCP, and then we're going to kind of go through a journey today and see how with the Dynamics ecosystem, we could help Joe to, prioritize that follow-up, help him to make sure he's getting those booked with the right people at the right timeline, and then able to follow through and manage his overall care across the network in a really seamless and personalized way. So the first piece here, right, is when Chris is actually visiting the ER. So he gets that referral for a PCP follow-up. And this is one of the places where a major set of referral leakage or a chunk of referral leakage kind of can happen, is when we have kind of disconnect between different departments, different locations, or even different health systems. And so we end up with having the patient's data in different EMRs and different clinical systems, and it's not all connected together. And for that reason, when we're communicating with the patient or planning their care, it's not considering the full picture. So having, data across systems, and how can we kind of keep those departments and locations and even different health systems all in sync together when we're on different systems to begin with. So within the Microsoft ecosystem, Imperium has developed IP that helps with providing an integration framework as well as native integrations into many EMRs, as Robin mentioned. But the key here is unifying that data into a single patient record that you can then use to treat your patient kind of holistically across the board. So this is unifying that data. In this case, right, it's pulling in the data from the EMR of the ER that has, his broken rib, but also that scan result with the incidental lung nodule and that referral for the PCP follow-up. And now the PCP is using Athena, right? Their data is also in here, and we can actually see all of that together in a holistic way. So care managers can really access that full patient story and make sure that they help him to get those follow-ups. Now, the second piece, causes of referral leakage, right, is just the patients not remembering or not knowing how to actually get in contact to book that follow-up. So, in the case of our patient here, right, he just broke his rib. So he's probably very preoccupied with that and not thinking about something else or following up at the right moment, right? He wants to first heal, and maybe he forgot about the other scan, or he lost the information of where to go by the time he's kind of recovered. So in this case, what Dynamics is really, really useful for is once we've brought in that healthcare data into the ecosystem, we can now leverage very powerful capabilities for creating lists of patients and doing kind of targeted and automated outreach. So in this case, we're using the dynamic segmenting capability within the Dynamics Customer Insights Journeys module that allows us to segment or automatically pull patients into a list based on whatever criteria we set. So in this case, right, if our goal is to reach out to all of the patients who have an open referral and have a lung cancer related diagnosis, right? So here we can see our segment criteria are pulling all the patients who have an open referral, like a referral in pending state, and they have one of a subset of condition codes or ICD-10 codes. So I have, C34.9 showing here, but if I scroll down, there are other diagnoses that are potentially related to lung cancer as well. So this is a very targeted and personalized segment that could have extremely personalized kinds of engagement emails and content going out to them to help them follow up with that appointment. But you can also have them as generic as, all patients with an outstanding order and so forth. But this allows us to target people at the right time and in a really seamless and easy way, right? No one has to manually go in and pull all these patient cohorts and figure out who needs an email now. It's just going to be automatically set up after that order is created from the EMR itself. And let me actually dive into the system a little bit as well. So we have kind of, just to show you what it looks like in Dynamics, I'm going to zoom in just a little bit. So I have, my patient record. This is where I have that unified profile. I am logged in my browser with my Office 365 account, and I'm able to see and edit information according to my security permissions that have been assigned to me based on my role or my team. But I have, all of my demographic information, some high-level summaries like my primary care practitioner or my primary locations. I have my insurance, my relationships, my emergency contacts, all of that essential information up at the front. And then I have my interaction timeline as well. So this shows all of my history of interactions with this health system, whether it's phone calls, emails, text messages, chat conversations, website visits. All of that information is coming here together. And then when I come to my medical history tab, I can see all of this information pulling in from both Epic and Athena, appointment history, immunizations, and I can see which system that came from and which location as well. And then I have allergies, my procedure history, encounters, conditions, and then my orders as well. So as we can see, these are actually coming from two different systems. So I have both Epic and Athena sending data for this patient, and they are being merged together here within this unified profile. And now that I have this data, this patient is now being brought into this segment within the marketing application automatically. So this is allowing me to filter by all of the medical information that I have access to, such as the orders, the statuses, the condition codes, which are the ICD diagnosis codes, and so forth. And I can access any of that clinical information on the patient's profile to create very tailored and targeted patient cohorts to allow me to create more personalized messaging. Now, if I come back to my slides here for a minute. So now that we have our segment, we can actually automate all of those reminders to help the patients close that loop and book those appointments. So maybe, there's multiple ways to schedule that appointment. So we can send them an email that says, hey, you had a referral for a follow-up with your primary care about this specific condition, and these are the ways you could book that. So this would be the phone number to call. This is the link to our scheduling online, or you can text us, or whatever other ways that you provide scheduling. But you can give them all that information with a reminder that they need to book that appointment. You can even send them text messages from here, and you can define kind of the sequence of it, right? You can say, we'll send an email first, and if they open the email and they book it, then we don't send them any other reminders. But if they don't even open our email, we can send them a text message after 2 days. If they don't respond to our text, we can, give them a phone call as well. So And then based on whether they book the appointment, you can branch that journey as well to have different messaging or a different set of reminders, maybe something more education focused around lung cancer itself as your second set of reminders. So it's all up to you, but it's a completely dynamic drag and drop experience that allows you to really create tailored journeys to target patients and help them with their care plan adherence. So all in all, this would really help with boosting the revenue of the organization by getting more follow-ups, and then making sure that you're giving your patients a really efficient care plan and care pathway. And this would also ultimately improve the patient health outcomes by helping them to follow the plan that's been put in place by their providers. So a little bit of a look at this journey piece. So each journey, right, you can select a segment, or you can start it based on a trigger. Any type of action can set off this journey, but then you can define all of the different content that you're going to send to them, when, and you can branch it based on the outcomes or the ways that they interact with that campaign. And you can also set up like exit criteria. So in this case, if they actually book that follow-up appointment, then we don't need to continue sending them reminders to book it. We'll probably instead start sending them reminders to attend their appointment. But this is really configurable and easy to use, and a great tool for not just kind of the traditional patient marketing to maybe new patients, but also for our existing patient database in that really personalized way. Now, so next, Chris, actually, he books that appointment, and he actually visits his PCP to follow up. And then at that appointment, he is, diagnosed with early stage lung cancer. So we'll look at how the system can help support his overall care plan as well moving forward. But one thing I also wanted to touch on is, we all know AI is such a hot topic these days within the healthcare ecosystem. One thing I wanted to just mention or highlight here is our AI assistant for nurses and physicians. So this is like a chatbot that any clinician can, chat, ask questions to on a patient record, and it will give them a summary of the patient's medical history, or they can ask for very specific things like their allergies or their last appointment. So this is really geared towards helping physicians get relevant information before they meet a patient about a specific, for a specific reason, than having to click through their whole medical profile and kind of gather a glimpse of what might be helpful for that visit. And the other thing to highlight here is that because, so this is embedded within the context of Athena 1. So it's an embedded application. You can have it running just with the data from within Athena, but because we also have the data from Epic coming into Imperium Health Cloud, so we're also able to chat with the data from there as well, or that unified data, and that would give the physicians additional context or information if you have information coming in from multiple different systems. So another great use case of kind of merging that data together, and something that could be relevant here as well when we come into kind of the care management side. And now within the, once we actually give that diagnosis, there are a lot of ways we can use the Dynamics platform to help with the care plan adherence overall. So one is by actually having those care plans within the Dynamics app, and that allows you to create journeys that automate the activities. So if your patient, now they have a cancer diagnosis, they need to come in, maybe every 2 weeks, maybe every month, or maybe they have recurring treatments that they're going for. So we can have those journeys to help them, remind them to schedule the appointments on a specific cadence. Additionally, something a lot of providers are using now is the PROMS assessments. And usually those are paper-based and not like embedded within the patient experience as much, or used to drive the care decisions. But this is something, for example, in the lung cancer scenario, right? We can send him this EQ RTC assessment on a periodic basis, every 6 weeks, every month, and help him to kind of rate his quality of life. And then we can adjust and kind of tweak our care plan based on those scores. And then lastly, once we have all of this data within the Microsoft ecosystem, we have extremely robust reporting capabilities. And one of the big challenges, right, that organizations are struggling with is identifying those areas of leakage within their organization. Which plans, which providers. Where are we getting the out of network referrals from? So all of these different pieces help to kind of, or need to be analyzed together, so we can kind of drill down and identify what are the real root causes within your organization of referral leakage. So that's where Power BI, Fabric can come in and use all of that data that we've pulled into the system, and then help you to improve and kind of identify those causes. Awesome. So that kind of concludes the demo portion itself. So talk a little bit about kind of the technologies behind this solution from an end-to-end perspective. That was showing Dynamics 365 Customer Insights Journeys, previously known as the Marketing app. And then Power Apps, Power Automate, and Power Pages for the patient portal experience. And then on top of that, we had Imperium Health Cloud Core running with our EMR integrations and integration framework. We have a PROM solution for automating those assessments. And then we have a texting module that can be used for HIPAA compliant texting, and our Care Journeys module for customizing those care plan automations. But all of this is completely HIPAA compliant platform. Your data is completely secure. It's within your own tenant, and you have complete control over the access to it. But yeah, if you want to kind of pursue making that happen for your own organization, this set of technologies can definitely get you there. And this same suite of solutions has many other applications within the healthcare industry as well. So aside from managing the referral leakage or trying to kind of decrease that leakage, we can also use the same system to market to new patients, or do many other types of patient engagement, right? Sending them event invites or reminders to prevent no-shows, advertise your different services, even send notifications or alerts to your patients based on, who might be at risk, based on the weather or any other type of event going on. You can also use it for provider outreach, right? Attracting and growing your network of providers and physicians. And then also from that patient data unification standpoint, which has many applications such as HIE, collaborative care management between different organizations, patient record requests, and even mergers and acquisitions. So there's a lot of different areas that we can touch on with this same solution. And today we talked about how we can use this for specifically minimizing referral leakage. So with that, I will hand it over for questions. Thank you, everyone. And we're really looking forward to seeing you at our roundtable next week.
Yeah, so in the chat window, feel free to drop in any comments or questions you have if you found this helpful. If there's something else that you want to look into, we would love to hear more about that. I know that one of the questions that we had before we came in here, Sarah, specifically was around what if you're in the government cloud. We know that the functionality across the Microsoft and Dynamics space is not equivalent between the standard cloud, public cloud, and the government cloud. So any thoughts to how this can be set up in that type of environment?
Yeah, absolutely. So the Customer Insights Journeys application is not available within the government cloud, but we still would have the ability to pull all of the data into that unified profile. And then there are many other ways that we can do that targeted outreach using other capabilities of the ecosystem, whether it's, Sales Hub, Power Platform. There's a lot of other ways that we could kind of achieve the same outcomes without using the customer insights journeys itself.
Perfect. You also mentioned, or at least touched on a little bit, HIPAA compliancy around the texting solution, but in general, any concerns there with the solution and communicating with customers with the data, the healthcare data?
Um, No, it's totally secure from a data standpoint, as well as, there's ways that you can set up the texting to be HIPAA compliant. So you have to use a, HIPAA compliant texting service, such as ours, or the Twilio HIPAA compliant texting. But then the HIPAA compliance is kind of twofold, right? It's not just about the data itself, but it's also about how you set up the workflows. So, for example, our texting solution has all of the consents within it, all of the workflows for opting into texting about health information, PHI specifically. So, all of those pieces are integrated with the EMR and then also updated based on their responses on text message. So, it's also how you set up those consent flows and also the user roles of who can actually see what data within the system itself.
Perfect. Well, thanks, Sarah. And as mentioned, round two is Tuesday, November the 19th, where we're actually going to have roundtable discussions. So it won't be so much of a webinar of me talking and then Sarah talking. We'll actually be listening to you talk and doing some collaboration and discussion about some of the trends you're seeing in this area and challenges, and just talking about ideas on how to go after referral leakage and resolve those problems and improve that continuum care for the customer or that patient journey. So thanks, everybody. Appreciate you taking the time and joining us here, and we look forward to more conversations.
Thank you, everyone.